Dr. Anthony Ruffa is with us right now, and you are at the Conneaut Health Center.
Conneaut Family Health Center. We're down at Route 20, off of right in the plaza, the Save-A-Lot Plaza, and we've been there for almost 2 years. I know the people of Conneaut have been blessing us and giving us the opportunity to serve them in this community. We have a great facility down there. We have an express care, which has been utilized a lot over the last year. We have ancillaries such as physical therapy, x-rays, blood work. Myself as a family physician, we're nearing about 2,000 patients there. And
wow.
Yeah, it's
you handle 2,000 patients? Or there?
How about myself?
Wow.
Not at one time.
Is that all right? Number 1,712 is no.
Yeah, come on in. Good. They'd probably wait as long. You know, I mean, we have some waiting time only because we try to be thorough, even though we run behind sometimes, and I think that's common for a lot of physicians. We try to keep it around 15 to 20 minutes behind, but sometimes, a lot of patients around here have not seen a doctor for 3 or 4 years, and been some physicians that have retired.
Yeah, right.
And as a result, we're getting them, and there's a lot of issues and medical problems that have not been addressed for a while, and we're pretty thorough. Pretty complete, trying to get their medical issues under control. And the nice thing is we have a lot of things there. As I mentioned, we even have spirometries for breathing. If you have problems there, we have nebulizer treatments. We have EKG, as I said, chest x-ray. So, it's very convenient for our patients to be able to come to our practice and really do a one-stop shop in most places. Obviously, if you need to get other more complicated tests like thallium stress tests or EGDs or colonoscopies, we send you all down to Ashtabula County Medical Center, because that's who we're affiliated with, who is affiliated with the Cleveland Clinic. Right. So that's the other advantage. And the nice advantage we have of that, Bob, is we have a computer system called Epic. And Epic is something where in the computer system, anybody in our system, specialists, physicians, Cleveland Clinic, as soon as a patient is seen, the minute they walk out the door, we can access that record through Epic. So it's really an enormously beneficial product that we have, and a means of keeping continuity of care, as well as, if you go to the emergency room at ACMC. Unfortunately, we're not connected to Brown Memorial or University Hospital because they have their own system. But we have the system, and we sort of encourage our patients to stay within the system of the Cleveland Clinic, Ashtabula County Medical Center, so that we can really access their records very quickly and keep a good continuity of care.
So that means that I don't have to remember, okay, what date did this happen to me?
Not at all. Nope, we go on.
I can remember my mother was in the Cleveland Clinic, and they said when she got out, she had a heart attack, is that she should go see the cardiac specialist at ACMC. When this was years ago, I don't know if he's even there anymore. And he's asking her questions like, okay, when did you have your first heart attack? And my mother had no clue, and I had rough ideas, and we had to bring our own list of medications and that kind of stuff.
And what we do is,
and so it's nice that.
So your mother's family physician had to request the records from the hospital, which sometimes could be a stack like that. Whereas instead of us requiring records from Ashtabula or Cleveland Clinic, one click, we're in. You don't even have to remember the date you went.
Right. I mean, that is so much. It's so much. Because I'm thinking they're relying on my memories when she had a first heart attack as far as treatment or something. It's like, oh my gosh.
Well, yeah, it's shocking,
Well, it is.
But the nice thing is, if you get a consultant, even if you get a test, if you come in to me and you say, I had a test yesterday at Cleveland Clinic or at Ashtabula County Medical Center, pop it up. We can give you the result before even the specialist can give you the result. So, like I say, we're sometimes patients, because of emergent, very critical status, they are brought to Brown Memorial. We have to request those records, and then we get those maybe a few days later. Unless they went to the emergency room, then they've been very courteous in sending us those, as soon as possible. So it's very helpful, and we're very grateful for having that system.
In fact, I think there were times that we actually physically carried
Oh,
the stuff from, okay, we're going to ACMC, so you stop at the Conneaut Medical Center and pick up the stuff and take it with you.
yeah, the thing
Which
is,
even at the time seemed like a little
well, yeah, and we save money too because, let's say you go to a colleague of mine that's within the system. Let's say you were in North Kingsville or Jefferson and you moved to Conneaut, you want to switch physicians, or you were at the Asheville Clinic. We actually could save you money because a lot of times physicians are allowed to charge you, I don't know, 15, 20, 25 cents per sheet, and then you have to spend maybe sometimes $100 to get your medical records to me. As a result, we could just click in, get all those records if they're in our system, and be able to really delve into them and see what you've had done, as far back as sometimes, 2005, 2006, because we've already put those records into the system. So it's really good for, good for patient care.
Right. And I think in my parents' case at one point, they would just do the testing over again if they didn't get them.
Unfortunately,
that's really, because none of that stuff is cheap.
Yeah, who wants to go through a colonoscopy?
Right, yeah, oh my, yeah, absolutely.
So anyway, but so that's our advantage. But I also wanted to point out today too that we, and I don't think the people of Conneaut are aware that our family practice, including me, I am the family practice there, we see pediatrics, and I think we also see gynecology too. But pediatrics, I think a lot of people, because they haven't had a lot of experience with family physicians in the area, because a lot of the doctors here, besides the pediatrician, and I think 2 family doctors, the most of them are internists. And internal medicine doesn't see pediatrics or kids. As a result, I think the mentality has been to go to a pediatrician or to go into Ashtabula County Medical Center, where we have a number of pediatricians there. And they're very good. They're excellent. We use them, and we don't discourage anyone from using them. But if you want to stay in the area, if you don't want to travel, a lot of people don't have gas to travel, they don't have transportation, a well child visit, especially when a newborn comes, they come at 2 weeks, then they come at 2 months, then 4 months, then 6 months, then 12 months, and 15 months, and that's a lot of traveling. We see these kids from birth until death, really. And we are able and capable to do that. We as family physicians are trained several months to see pediatric children, and we are equipped with the immunizations and the testing that is necessary. And the nice thing is, when you have a family practice, if a parent brings their kid, we have, and we're seeing that parent, we have that whole family dynamics of, okay, your parent, had maybe, we know the dynamics of what's going on, whether there's, a marriage has broken up and there's a stepfather, there's some disease in the family that has been going on in the family, there's some genetical issues, and siblings. We're able to do the whole family practice. So, if we're treating the father, the mother, sometimes we're treating the grandparents too, we're able to bring that child in from 0 until all the way, 18 years old, and then we move on from there, and be able to cover all those topics. And the nice thing is, if we have issues, we're connected to the pediatricians at ACMC. So I could call them, or I could send them down, and they can take a look at them if there's something that we need further consulting or advice on.
But if using you as the child's doctor rather than a pediatrician at 18, they don't have to start shopping for another doctor?
At 18, the pediatricians usually dismiss them from the practice, and that's where they start looking for another doctor. And a lot of 18, 19, 20-year-olds aren't going to see a doctor unless they need a sports physical, or unless they... But the issue about that, though, is, so we're very well equipped, as I mentioned, for gynecology. If we have a young woman who is experiencing some pelvic pain, or has been sexually active and now thinks that she might have a sexually transmitted disease, and that's an issue everywhere in the country, and I've experienced it here, where there's 12, 13-year-olds who are sexually active. Some 5, 6 partners already, which is amazing. But
What do you say to them? Or do you just treat
Well,
it, or do you talk to them?
oh no,
about-
no. We talk to them. We basically tell them, listen, you're at high risk for pregnancy. You're at high risk for sexually transmitted disease. Emotionally, a woman more so than a man becomes attached to the person that they have sexual relations with, and as a result, you're going to have some emotional problems with this. It's tough, yeah. But I was kind of shocked when I hear these kids, and it's not only here, but it's around the country, and it's just because of the sexual freedom, quote unquote, that this country has experienced. It's the pornography that's there. So that's dealing with 12-year-olds to 18-year-olds. Of course, we see them for sports physicals.
Right.
We see them for regular physicals.
Do you still go to football games and stuff, or?
I went for 2 years. I was the team physician. I sort of abdicated to Dr. Nathan Franley. He actually is trained. He has a fellowship in sports medicine.
Oh, okay.
So he knows a little bit more about sports medicine than I do. And so even though I loved being on the football team as a team doctor and working with Coach Dobrand, I figured that the team could probably benefit from a person who is experienced and an expert in sports medicine. And he's doing a great job, But we do see kids for sports medicine exams. We see them for school physicals. We see them for work physicals. Those are the older groups. The younger groups, immunizations. We have a lot of children, obviously, who need immunizations.
Sure.
They get out, they need a Hep B. At 2 months, they need 5 shots, but we give them 2 shots. Actually, 3 shots, I believe it is. One that it combines 3 or 4 shots, and another that we give 2 separately. And then, so that goes 2 months, 4 months, 6 months, and then 12 months they have to get a varicella and MMR, and then 4 years they get boosted with those and boosted with other shots. And then they go on to be 11 or 12, and we give them a meningitis shot. So we have these not only for commercial patients who have regular Anthem, Medical Mutual, Cigna, United Healthcare, but also we have the VFC, the vaccines for children, through Medicaid and other insurances that are more government sponsored, so that we're able to provide immunizations in the office, which is very convenient for patients. And in addition to that, like I said, we have, if a child usually needs blood work, lead, hemoglobin, STDs, we could do everything there. They don't have to go. In most cases, they don't have to go to the hospital or to a lab, but they can come there, get their exam, get their immunizations. They can, if they need a chest x-ray, they can get the blood work. Everything is right there, and we could share that with the patients as soon as we get it back. And the nice thing is, obviously, with STDs and young men and women, we could have the test done that day and then bring it back the next day. Urine pregnancies we can do and have an answer that day. So it really is a convenient practice for, as I said, from the time of birth, we bring you at 2 weeks, all the way to 18, and then after that we take over with the internal medicine. And the other thing is, too, we treat for a condition such as attention deficit disorder, which is very common, and it's about 11% of pediatric children suffer from ADHD, and we're able to screen, get counseling, and put the kids on Adderall, Strattera, Concerta, any of those medications, and we're able to follow them as well. For the adolescents, we could do drug testing. I mean, we just have it all, really. We have, for kids, we have it all, and I just think that even though there's a pediatrician in town who is very good at what she does, we want to be able to offer the whole family dynamics from, 0 to 100, and we have patients who, I don't think they're 100 yet, but about 90, 91,
right.
And we treat them. So it's very, very convenient, So it's a practice where we are seeing children we probably have 50 children under the age of 18, and we're growing with that, though. I think with the education in the community, understanding that this is what we do. Again, you know, a lot of patients of mine, when I say I want you to come back for a gynecological exam older, obviously we usually don't do it until, you know, 25, unless they're sexually active. They're kind of shocked that we actually do gynecologic exams, pap smears, and we do. We don't place, you know, any IUDs if they want an intrauterine device for birth control, but we do a lot of workup for that. So,
what about breast exams?
Breast exams for older patients, obviously, we do those on every encounter that we come in with breast exams. They have their gynecologic exam, we do a breast exam. I forgot to mention, we even have mammograms at our place.
Right, that's, yeah.
Yeah, so that's very convenient. We could schedule you. Sometimes, if we're lucky, we can get you in that day. But we have our mammographer coming in sometimes, you know, I think 3 days a week or something. So, yes, we could do breast exams. Interestingly enough, things have changed, kind of veering off pediatrics, but things have changed where really if a patient, a female patient, comes in and we do an HPV exam, which is a gynecologic exam, we do an HPV testing, which is for cervical viruses that can lead to cancer, especially 16 and 18. We do that HPV and we do a pap smear. They're done for 5 years if that pap smear is normal. They don't have to go back for 5 years. Breast mammograms, once we do them and it's normal, 2 years. So I don't know if a lot of physicians are practicing that, but we are going by the standards of care, where the pap smears, if normal, are every 5, and the breast exams, if normal, are every 2 years. And so a lot of patients are pretty relieved to see that, you know.
Now there's a difference if you have it in the family.
Well, for mammograms, not really. I mean, if that goes more for colonoscopies, if patients have had a family history of colon cancer, we usually do it every 5 years unless they have other issues like an adenoma, which is a precancerous lesion. We'll do that every 3 years. We don't do them in the office, but we send them to ACMC. And the nice thing about ACMC, Asheville County Medical Centers, we can do 95% of the procedures there. Anything that's more complicated, like if you have to have a stent placed in your heart,
Right.
or if you have to have a defibrillation from atrial fibrillation, we usually send that on down to Cleveland Clinic and have them do that. But we do have Cleveland Clinic cardiologists that are there, and we have probably half of our staff that are there are Cleveland Clinic physicians. So, and you know, Cleveland Clinic or not, they're all very well trained. You know, they're all very busy. We are seeing a number of patients, and sometimes it's a little difficult to get in one doctor, so we refer you to another, but we try to get you in as soon as possible.
Okay.
So it's very good. Yeah, we offer a complete set of care. And the nice thing is, as I mentioned, with patients, we have their families and we can talk to their families. Sometimes the mom or the dad is there with you know, a 17, 16-year-old child, and I ask different questions, and one of the things they say is, "Are you sexually active?" And they say, "Mom, can you leave the room?" And the mom's, you know, mouth drops, you know. She slowly crawls out of the room, and I talk to the patient, and then they kind of bare their soul, you know. But that's what we do, you know. And a lot of times that's not asked, but I think a big part of pediatrics is counseling. We counsel on, you know, dietary, we counsel on exercise, pediatric obesity. Terrible.
I was just going to. Can we take just a second of a break,
Absolutely.
because that was one thing I wanted to talk about when you were getting into some of the ADHD.
ADHD.
Yes.
Right.
And so let's talk about that, and we'll be back. And there's been a lot of stuff in the news. We're starting to talk about that, about childhood obesity. And I read on the air a while ago that there's some tests, something about spinning or something with kids, that in like 1983 everybody passed, but in one class only one kid passed because they're not out there on swing sets and
well, you know, I mean, I don't know how old you are. You look young, but it was during my day when we went to, I was in a Catholic school, and we would actually, when the bell rang, we'd go in, after playing on the playground, we'd go in sweaty.
Right.
I mean, our shirts were full of sweat.
Yes.
Now, I remember dropping my daughter off one time and seeing all these kids just sitting there like this. And it's really, and plus the food, the portions have gotten so big. It's really, you know, we used to spend 10 cents on a hamburger, you know.
Yeah. You must be about my age.
I think so. But, you know, so it's and we were always involved with sports, you know. So it really has come down to a point where, number one, these kids aren't exercising, and that's why they need to be in a sport. Even if they're not good, they need to be in a sport. And there's enough sports in this city,
right,
you know, through the high school and through the community, that these kids, and I would encourage patients to get these kids in, because if you get pediatric obesity, you're going to get hypertension, you're going to get depression, they may get bullied, you're going to, you know, they're just not going to be healthy, not only then, but through life.
My grandkids are in Cougar Wrestling, so we went there last night. It's on the top floor of the American Legion.
Yes.
And they were out there wrestling, then they play some dodgeball, then they have to do some push-ups, and then they have to do some sit-ups, and then they run around playing some more dodgeball.
That's awesome.
And yeah, I asked my daughter-in-law if they go to sleep well. Yes. They want a little snack at his bedtime.
Yeah, as long as they don't get Big Macs for dinner.
Right.
And French fries, you know. That's another component, is diet.
Right.
I mean, I understand, you know, it can be difficult to, you know, purchase good food. But let me tell you, you know, for the price of a bag of potato chips, you can get a bag of apples. And, you know, kids have to eat properly. And that's the parents' responsibility. I have 4 kids, and our kids were growing up, and we didn't spend a lot of money on food. We just bought the right food. It's tough, and it's tough to make those changes, but it's very possible. And I think if we really were conscious about their food and about their exercise and involvement, you know, we always say kids in sports stay out of courts, you know, and it's true, you know, especially in a small town like Conneaut. A lot of kids have told me, you know, if they're addicted, which, by the way, I had been board certified in addiction, and so very qualified to handle addictions. But if they've been, you know, hitting the drugs or sexually active, they say it's only because they have nothing to do, you know. And so that's why sports is so important around here, because if you're not involved in sports or other activities, you're going to be bored. And when you're bored, you're going to get into trouble, or you're going to get sick, and you're going to get addicted, or you're going to get pregnant, or you're going to get a sexually transmitted disease. And that's the other thing. Parents need to know where their kids are.
Yeah.
There are times, you know, kids have been sexually active, and I ask where, they say in my house. And the mother will look at me and say, I never knew. Well, you should know. I mean, you should know if your kids are in that house and the door should be open, you know.
Right.
There should be, a lot of times in the country, unfortunately, you know, it's, you know, ignorance is bliss. And so parents don't have that, don't feel they have that responsibility for kids to, you know, to watch their kids. And that's where sexual abuse comes in too. A lot of times, you know, kids will be sexually abused. I have a number of females who were sexually abused by a number of different relatives, particularly when they were younger, and it's devastating.
Yeah.
Devastating.
And how many people don't tell anybody, and
They
they're
don't.
40 and 50 years old, and they're still.
Yeah, I'll ask them. I'll say, "Have you told anybody?" And they say, "No, maybe their husband," and they never got help. And yet they're obese because of what's underneath and lying there. They're guilty because they think it was their fault. It's a terrible thing, and I don't think it's improved at all, although the laws are more stricter, you know. But, so, you know, that's another thing.
Well, you were talking about food and stuff, but like I did a video a few months ago, produce giveaway the first Monday of every month at the
Salvation Army.
Well,
the food pantry.
The food pantry has one, and you have one there too. And I was there when they brought in all of this stuff, and there were a lot of people waiting, and they all got cabbage and apples and carrots and bananas and different things like that. And then there was still a lot of stuff left over, so they were invited to go back through again.
That's great.
So
that's fantastic that they would do that, you know, that people show up.
And it was good stuff. I got a half a banana. Somebody, volunteer walking by was cutting an apple. He walked over and hands it to me.
Hey, that's healthy too, you know.
Yeah.
You know, so it's extremely important that, you know, the kids eat right. And as we go into the winter season now, we have to watch, you know, the little ones, you know, who may be getting croup or rotavirus. Very important, not only to keep up on your immunizations at 2 months, 4 months, 6 months, then you have to go to 9 months visit, and then 12 months and 15 months. All those have shots that are given, but also the flu this time of year. Really, your child over the age of 6 months needs to get the flu shot. And you need to get the flu shot, and you need to get the pertussis shot, the Tdap that we call it, because if you have little ones get pertussis from us.
Mm-hmm.
And so we have to be immunized, and if grandparents are watching kids, they have to get immunized with the pertussis shot. The flu has taken a number of kids, younger kids. Those are the ones that die, and the older folks, young children, young infants, toddlers, and older, you know, die from the flu. So you should get them immunized. You know, rotavirus is a diarrhea type illness which usually goes away. You know, croup usually is just very simple and goes away. You know, we talk about the different things, you know, that can undergo and kids can undergo and have, and those are things that we can follow as well.
Let's see, will you take a phone call real quick?
Sure.
Hello, you're on the air.
Yeah, you got.
You're not some. Did you understand that?
I did not.
No, can you say that again?
Bar.
Okay.
Well, I can't answer that question.
Sometimes the cell phone things, it makes it sound like they're underwater.
Yeah. Well, you know, and then also we have the express care. So if your child is sick and you can't get into your pediatrician or your family doctor, bring them in. We see kids, you know, at the express care. We don't see infants. If you come in, I can see the infant. Our nurse practitioners are only allowed to see children that are a little bit older than I think it's I'd have to check what it is, but I think it's 2 years old maybe, and then anything younger we can see. But our express care is in our building.
Okay.
And so you can come on in.
So when are the hours for that?
The hours for that is 9 to 9. Well, 9 to 8:30.
Okay.
And then
Is that 7 days a week?
Monday through Friday, and then I think on Saturday it's 9 to 1 or 9 to 3, and then on Sundays I believe we're closed.
Okay.
It's in my building, but obviously I'm not very well connected to it because they have their own practice and I have my practice. But again, anybody could come into that practice, express care, walk in. The nice thing about that is instead of going to the emergency room here, you know, and pay a larger copay, you know, anywhere from $25 to $100 to go into the emergency room, you can come into our practice and pay your family practice copay, which in some instances,
Wow, yeah.
for medical assistance I don't think is anything, and for other medical plans usually is maybe $10. So it's a whole lot cheaper to come to express care if you have a minor problem.
Mm-hmm.
I mean, if you're having chest pain or severe problems with your lungs, you know, or severe abdominal pain, yes, you go to the emergency room. But if not, you know, come to express care, walk in, we're there, we can see you, I'm there in case the nurse practitioners need help. And then if you bring your kid in and your child and like our practice, you know, sign them up and bring them on back, and we can take a look at them and follow them from there.
Okay. Excellent.
Good.
All right. Well, thanks for stopping by.
Well, I appreciate it. I appreciate you having me. And this is, I'm going to ask you how old you are because I'm curious. Because you have grandchildren and I don't, so you have to be a little bit older than I am.
62.
I'm only 57, so I'm younger than you.
Although I had them at that age.
Hamburger, what's that?
Henry's 6, so I must have been 56, 55 when he
And you had a, okay.
They are
So-
hilarious.
Yeah, oh
and,
yeah.
And we climb trees together, we ride
yeah,
bikes
I mean,
together, and yeah.
Yeah, that's, see, hamburgers were 5 cents when you were younger. They were 10 cents for me.
I know, they were 10 cents when I was there, sloppy joes. I don't eat meat anymore. So.
All right. Are you a vegetarian?
Yeah.
That is awesome. No wonder you are thin and in shape. I don't recommend everyone to be vegetarian because it's very, very difficult. I mean, President Clinton
It isn't as much as it used to be.
No.
But we can talk about that next time. But I can talk about what it used to be to get like a veggie burger, what it is today. It's much more variety.
There is much variety.
Yeah.
Exactly. And my wife and 2 kids are vegetarians. And it drives me nuts because...
So the next time you're on, I'm going to ask you if you've become a vegetarian.
No, I'll never become a vegetarian, I don't think, unless I have heart disease or something, but I tried for a week. But I do eat healthy, obviously carbs, we can stay away from carbs.
Right.
And that's what I recommend for kids. Anything we can recommend for kids, stay away from carbs. If it's white bread, we say, white bread, you're dead. Because that's easy to remember, don't eat anything white. Don't eat the pizzas white, don't eat the bread white. And then bigger than that is stay away from the pop. The sugar pop, the Gatorades that have sugar, the energy drinks. I went to go see, every time I go to the store, I'll see if I want to get something to drink, I'll take a look at the back to see how many sugar. Mountain Dew has 78 grams of sugar. That's like drinking 3 cans of pop.
And a whole lot of caffeine.
And a whole lot of caffeine. Yeah.
Then they go on the ADHD stuff. All right.
Okay,
Thank you.
good to see you. All right.